Hello, everyone. Welcome to this series by the American Migraine Foundation. It's good to be with you now because there are so many people who are suffering from migraines and having trouble managing their headaches. So, hopefully, I can help you with managing your headaches. And the good news is that there are so many things you can do to improve your condition. Many people have more headaches because they're under stress and they're not getting a regular sleep, and the diet is different, and they have to sit in front of a computer screen all day long if they're lucky, if they have a job. So, what are the things you can do? First of all, the fact that you can do something is very empowering. Psychologists call it external versus internal locus of control. So, if you feel like things are happening to you, you have no control over it, and you can't do anything about it, chances are you're not going to feel as well as if you feel some sense of internal sense of control. And you can actually shift the locus of control, as psychologists call it, from external to internal. And we have good scientific studies showing that people who have this internal locus of control do much better with chronic pain, with migraines, and other conditions. So one of the things you can do to take care of yourself in these challenging times is to exercise. It's number one on my list of recommendations when I see a patient with headaches. We always start with, of course, the diagnosis and triggers and trying to eliminate that. But the first active therapy that you can do to improve your migraines is to exercise. Of course, everyone thinks, yeah, exercise is good for you. I know that. But in fact, we have good scientific studies showing that exercise, while being good for you, it's also a very specific treatment for migraine headaches. There's an interesting study out of Sweden where everyone is in their electronic database. It's socialized medicine there, so they can do very, very sophisticated research. So they looked at over 46,000 people, and they found a very strong inverse correlation between the frequency of exercise and frequency of migraines. The more people exercised, the fewer headaches of any kind they got. And then the same group of researchers took a group of 100 patients and divided them into three groups. One group received a prescription drug called Topamax, topiramate, which is an effective migraine drug, but has many side effects. Second group did meditation and biofeedback. And the third group exercised. So guess what? The exercise group and meditation group did equally well. So did Topamax group. All three were equally effective, except for Topamax group had lots of side effects. So exercise has a very good scientific support, and we have a good explanation of how exercise works for you, not just release of endorphins. Everyone knows about endorphins, they're runner's high. You don't have to get to that level where you feel euphoric from prolonged exercise. Even moderate exercise improves outcomes in many diseases. And the reason for that is when you exercise, there is a release of BDNF, brain-derived neurotrophic factor. That's a proven fact. And that nutrient is very important for the normal functioning of your brain cells, neurons. And that's why exercise actually might prevent Alzheimer's disease and many other conditions that occur with age. So I hope I convinced you that exercise is good. Now, I often hear a counter-argument from patients, well, exercise gives me a headache, which is not unusual. It's a real phenomenon. We call it exertional headaches. So exercise can do that, especially if you don't exercise regularly. If you are a weekend warrior, that is, you don't exercise all week, on the weekend you overdo it, you'll get a headache. Some people tell me that even a mild exercise, even if they do it regularly, still causes a migraine. So what can you do? There are several things you can do to prevent these headaches. First of all, it does help to start slow and gradually increase the intensity of exercise. The second thing that migraine sufferers usually try to avoid is shaking of their head. So running may not be the best exercise for you, although I have some patients who tell me a jog relieves their headache and they feel great. But for most people, shaking of the head can bring on a migraine. So the ideal exercise is a stationary bicycle where you sit, your head doesn't move, you just move your legs, and you gradually increase the frequency of the exercise duration and intensity. Swimming is a very good exercise that also does involve violent movements of your head. So that's one thing you can do to prevent exercise-induced headaches. Second thing is sometimes taking a 2-Advil before exercising may prevent that as well. If Advil doesn't do it, then a prescription drug like sumatriptan might. And you don't do it forever, you just do it for a few weeks. Your body gets used to regular exercise, and then you can stop taking these medications and continue to exercise. So those are some of the tricks that allow you to exercise without getting a headache. So besides the stationary bicycle and swimming, the so-called aerobic or cardiovascular exercise, you can also try something like a high intensity interval training. And that's a very popular exercise. And I actually do it myself because it's very time efficient. Everyone's pressed for time. So it's 10 or 15 minutes of very intense exercise for 1 minute, then rest for 1 minute, then intense exercise for 1 minute. And there are different things you can do with either weights or something cardiovascular, but very intense for a minute on and off. And that's been shown to be as beneficial as maybe a 30-minute jog. So high intensity is an interesting alternative when you're pressed for time. And then there are other exercises that we recommend patients with headaches, and some of those involve the neck. Many people with migraines will often have muscle spasm in their neck, tension in the neck, and some people will tell me, before I get a migraine, I always get a spasm in my shoulder and neck and becomes a migraine. So what can you do about that? And this is particularly now the time when more and more people are getting neck stiffness from working at home on the computer all day long, including kids. I just did telemedicine visits with several patients, including children, who sit in front of a computer, and they tell me it's more work than going to school. They sit for 5-6 hours on end in front of a computer. So I always tell them, make sure your posture is proper, you sit up straight, and you're positioning your screen appropriately a little down, and your arms are parallel to the ground, and your thighs are parallel to the ground, so you sit in a comfortable position. Nevertheless, sitting all day long in front of a computer screen can often give you stiffness in the neck. And people often ask me, is the neck spasm causing my migraine? So migraine causes my neck pain. It's a chicken and egg question. In some people, migraine will cause muscle spasm. In other people, muscle spasm in the neck will cause a migraine. So there are several exercises that you can do to eliminate that. One of them is called isometric exercise, which is pressing against resistance on one side for 10 seconds. You can try now, 10 seconds. You slowly count to 10, a little longer than I'm doing now. And then 10 seconds on the other side. Your head doesn't move. That's why it's called isometric. And then both palms, heel of the palm, you press in front, and you feel pressure, 10 seconds, and 10 seconds in the back. So what it does is strengthens your muscles. And if your muscles are strong, they're less likely to go into spasm. The other thing I recommend, if people are doing the aerobic exercise, they're running or they're doing stationary bike, elliptical, and they have a lot of tension in the neck. So I always tell them, you do need to do some exercise for your upper back to strengthen these muscles, whether it's simple yoga, Pilates, or anything else that involves the upper back. And that's really very effective. There's another very interesting, fascinating, and little-known method. It's called Feldenkrais method. It's actually not a therapy. It was developed by an Israeli physicist, not a medical doctor. And he developed this method over 80 years ago when he injured his knee. And he was a martial arts expert. So the Feldenkrais method is still being practiced. He quit his physics job after being very successful working in very prestigious institutions like the Sorbonne in France and in Israel. He was a very famous physicist. So he decided to quit his physics job and just go around and teach people this method. It's really very unusual because it doesn't actually work through your muscles. It works through your brain. I'll show you one exercise that is really very, very effective and very surprising to most people. So I'm sorry, I'm going to turn this off. Um, so here's the exercise. First, I want you all sit on the edge of your chair or stand up, and then put your hand. First of all, actually check the range of motions for your neck. See how far it goes normally. Left and right. You'll see some stiffness at the end. Then put your hands on your cheeks, put your arms against your chest, and twist your waist. Don't move your head, neck, and body. It's all one block, and just moving at the waist and the hips. You do it 10 times to one side. You can do it 7 times right now, but eventually 10 times to one side, and then you do the same to the left side, back and forth. And your head and neck don't move. And then you put your, after 7, 10 times, you do that, you put your arms down and then test the neck motion, and you'll see it gets better. How does it happen? You didn't move anything up here. So the theory is that your brain gets very powerful input from your eyes. So when you move this way from your waist, the brain sees how far you can go. And when you move next with your neck, it expects you to go as far as you went from the hips and from the waist. And that's why it lets it go. It relaxes the muscles. If you try it, you'll be pleasantly surprised. It's really strange. There are several other Feldenkrais exercises. You can find them on YouTube if you look for the Neurokinetic Center channel. And also you can Google and find other exercises. And there are therapists, sometimes there are physical therapists who are trained in this Feldenkrais method. Feldenkrais, it's spelled. So it's another interesting method that you can try at home. So it's very, very gentle, doesn't hurt, and can be very effective, more effective than really massage or chiropractic. And people love having massage, chiropractic, acupuncture, and I am a licensed acupuncturist, but I don't do it very often because I tell my patients, try to do more active therapies rather than passive. We call them passive because you go for massage or acupuncture or chiropractic, please fix me. So you just lay there and things are being done to you. It's not as effective as if you really take charge and, again, actively exercise or meditate, which is another topic we should talk about. So active therapies also give you this sense of internal locus of control, where you have some ability to control what's happening to your body rather than things happening to you. And of course, exercise is very important for the relief of stress and tension in general. It is difficult when you're locked up, but there are so many online resources where you can find exercises that you can do without any equipment at home. So try to do that. So the second very empowering method and approach in general is biofeedback and meditation. Those are related treatments. So biofeedback has been subjected to over 100 clinical trials in migraines and tension headaches as well. So biofeedback is, in essence, computerized relaxation training, where you get a feedback from a computer screen. The psychologist or a nurse places an electrode on your finger to measure temperature of your finger or muscle tension in your body, or it's called galvanic skin response, sweating, because when you're tense, you tend to sweat more. And the feedback comes from the screen. And there's another, actually, a more recent form of biofeedback called neurofeedback, where they place electrodes on your scalp, and you can actually visualize your brain waves, like an electroencephalogram. And then you can control and change the waves on the screen. It seems like it's impossible, but in fact, it is very, very possible. But before you can achieve any of this, before you can control your brain waves or temperature of your finger, you have to deeply relax. And if you deeply relax your body, you will be able to control functions in your body that normally are not under your conscious control, like temperature of your finger or muscle tension or brain waves or breathing. So that's another very effective method. But biofeedback usually involves going to a therapist, whether it's a psychologist or a social worker or a nurse, and having usually weekly sessions, 10 sessions or more, which is very effective, again, proven to be effective, but it's time consuming and it's expensive. Insurance companies often don't like paying for biofeedback. Um, Again, the advantage is you have a coach, somebody who teaches you. There are many devices you can buy on the internet that will give you feedback, and you can learn how to do it yourself. And meditation is a form of biofeedback. Meditation is really scientifically proven method to treat various conditions. We don't have as much evidence for meditation as we do for biofeedback. I call it poor man's biofeedback because meditation does change the structure of your brain. So we don't have proof that biofeedback, the meditation will help your migraine. We have some studies suggesting that it does, but it's not as definitive as it is with biofeedback. So meditation has been subjected to MRI studies where they showed that the course of meditation, and people who meditate seriously for a long time will have their brain expand. So I still get occasional reports from radiologists when I send a patient for an MRI scan. And if it's an older person, the report sometimes will say age appropriate atrophy, meaning as if you're 80 years old, little shrinkage of your brain is normal. Well, that's not true because they looked at meditators and their brains never shrink. And they also looked at people in chronic pain where there is some shrinkage of the brain, certain parts of the brain due to chronic pain and many other chronic conditions. And the imaging shows that if you meditate, you can actually expand your brain. The old theory was the brain never regenerates. Only you're born with a certain number of nerve cells and they're just dying off. Well, now we have good evidence that there are stem cells in your brain. We have new cells that we can grow in the brain. And more importantly, you can increase the size of your brain. And that comes not from more of the nerve cells. It comes from more of the connections between the brain cells. So it's the white matter, not the gray matter, that gets thicker, and the brain actually visibly expands. So that's one argument I make to my patients and everyone else who would listen, that you should meditate. And of course, everyone's asking me, do you meditate? That's one of the reasons I do, is because I don't want to be a hypocrite telling everyone else to meditate and not do it myself. But I really feel the benefit. But I always warn everyone that in the beginning you will feel like you're wasting your time. You just sit there and your mind keeps racing. And people tell me, I cannot do it. It's not for me. Well, it's exactly for you, for people who cannot do it. Because for people for whom it is an easy thing, you don't need to meditate. Of course, you could benefit. So try to meditate and give it a few weeks, just like going to a gym will not make your muscles strong after a week or two. Same with meditation. You have to keep practicing. And again, you can start with a few minutes at a time and then do it longer and longer. And there are many very good apps for meditation, such as Headspace is probably the most popular. And then there is Calm, 10% Happier is a good, and there's also a free podcast from a very good psychologist, Tara Brach. It's tarabrach.com, TARABRACH.com. I met her. She's an amazing psychologist and meditation teacher, and she teaches many courses. And I did take one weekend course with her. So she has free podcasts. You don't have to pay for the app, although all the apps give you a free trial. So in these days, of course, you can't go for biofeedback, but you definitely can try to meditate, and don't be frustrated. So in summary, two most important things that I always recommend to my patients, and particularly now it's very appropriate when you have difficulty getting out and maybe getting as much exercise, but exercise 20 minutes. People often ask me, how long do I exercise? 20 minutes, 30 minutes, ideal. More is better. And at least 3 times a week. 4 is better. And I often tell patients, try to aim for every day. Maybe you'll get 3 in. If you aim for 3, you'll get 1 in. So, and the same with meditations. People say, when do I meditate? Well, morning is actually the best time because your brain is not cluttered. Don't check your phone first thing in the morning. I try not to. But first thing you do is meditate, and you will find yourself calmer throughout the day. Start with 5 minutes, or 5 minutes twice a day, or 10 minutes, and more, and you'll see some benefits.